Hi,
Hi, hello.
I'm Inbal. Thank you for joining us at the Jerusalem Post podcast.
Thank you very much, Inbal.
Eyal Gabay, chairman of Meuhedet, former director of the Prime Minister's office.
Indeed.
What a great honor to have you here. On October 8th, I'm going to dive right in. On October 8th, Meuhedet clinics were already opened, and you were ready for action when the country was still under shock.
Yeah,
And this was a very important thing. How did you manage doing that?
I think first of all, it's the people that work in Meuhedet. They have the feeling of obligation. The members are our family. We see them as not as customers, but as members of Meuhedet. And we belong to the community, and the community is part of us. So we must operate. And it already started on October 7th in the morning that the management opened a mental health hotline in order to help the people because we felt the surge of a need. And people that were in the Nova Festival hiding in the bushes, hearing people being murdered around them, friends are raped, the shouting and all of that, they needed help right away. And we recruited every professional therapist that we had and opened the mental health line, and were able to meet the need right away. And the day after, to open the clinics in the north and certainly in the south, where still the
Everything
rumors
was going
about
on.
terrorists roaming the streets of Ashkelon
Yeah.
was still up there. And people and schools were closed, so professionals and medical team and administrative team had to decide if they just leave their families at home. Sirens need to go to the shelter on the one hand, and they need to be at the clinic. A few days after, we visited all our frontline clinics, and we spoke to the people on the field, and they said it's the obligation, the duty that we felt. This is what sent us to the clinics, and we, ever since from October 8th till today, the clinics are open, and we are very proud of them.
Yeah. So you, okay.
אוקיי. רגע, אז רק שנייה. נרים את זה קצת. תגידי אם אני חברה במקום הנכון. אוקיי.
תגיד לי מתי? So on October 8th, Meuhedet received already phone calls from civilians in need to get what kind of help?
Mental health, comforting, making sure that the trauma, and everyone in Israel experienced trauma, but there were people that experienced harder trauma than others. To make sure that the trauma doesn't transfer to post-traumatic situation, because then it's very hard and continue with the person's life. And to make sure that we can contain this problem, help him within his mental situation. And those who are in greater need, we transfer them to ongoing mental treatment with excellent professionals that we have up to today, and people get what they need and deserve. And it's continued up to this day. Some of them are reserve duties soldiers that came out from Gaza with complex problems, and not everything is being treated on the spot in the army, and we need to follow them within the community treatment.
And you basically opened mobile clinics on right after October 7th to help the evacuees. There were a lot of evacuees from their homes, and you had to open this whole system. How can you do that?
Yeah, that's really, this is something that nobody in Israel anticipated.
Yeah.
Hundreds of people, hundreds of thousands of people evacuated from their homes to remote places let's see other places that in the center, not in the south, but in the Sharon. And you need, first of all, to know who is where and what exactly the needs are everywhere. And the idea was to bring the services, the health services, to their place, not ask them to go to this clinic 1 hour drive from them or something like that. And the solution was really mobile treatment clinics, especially for women, because the needs are different. And the mobile units were great success. We continue up to this day.
Really? Wow.
And now it's not for anymore for the evacuees, but we send them every place that there's a need, and there's no clinic that can
Physical
help.
clinic.
Physical clinic. It provides a solution, excellent solution, and people were very happy with that. And in addition, use telehealth. This is very important, not just for the evacuees, but also for the periphery in Israel.
Yeah.
Because availability is very important. And when you are in remote places, you don't get an access for the best professionals in Israel, because usually they're in the center of Israel or something like that. When you use telehealth, you can close the gap, bring the professional to the periphery in no time. And this is service that we've developed throughout. It started with the COVID, and now with the war, it was more and more advanced. And it's really helpful, and people do appreciate it when they can consult a doctor that works with one of the prominent hospitals in the center, and use him instead of traveling miles and miles away.
Amazing. So if anyone needs help, they will approach the Meuhedet and they will get their needs
Exactly.
by these
exactly
mobile clinics.
And what
was that your idea to?
No, it's not mine. It's something that we took from the world. It's being used in the United States. We were in a conference in the United States, and we have seen that and said, listen, this is an excellent solution for Israel.
Exactly.
And this is something that can be very unique. And, we are not the largest HMO in Israel on the one hand. On the other hand, because of that, we are really weak.
Able to give them what they need.
Exactly. And
it's private enough for them to feel not lost in such a huge organization.
Exactly. And we're very flexible. We know, usually we like to know our members' names by their name when they walk on to the clinic, to know exactly who is whom and what does he look for. And this is very important, because this is one of the two major things in a person's life: education and health. At the end of the day, when we look around, this is a constant service that is really part of the quality of life of every person.
Yeah. Well, I'll just say on a personal note that as a member, I can tell you that that is definitely the feeling.
Thank you.
So tell me, we've been through a very, very big crisis, and you've been in different divisions before, in the ministry, the Prime Minister's office. This is something that these crises teach us things about, leadership. What do you feel like you have now stayed with you after this whole thing?
On a personal note, I think leadership is the most important thing in Israel, certainly in Israel. And personal example is very important when we look at the leadership. No question, we have a big crisis, both in leadership and in everything, almost everywhere around us. And when we look into the organization we lead, each one of us need to be the best of himself. This is the only solution, because there's no state to look and say, help me. We are the state.
Yeah.
The people who fulfill the leadership positions throughout the public sector and even the private sector, because we can see that the private sector and the public sector are working together in many areas. And when people tend to say, it's not me, it's someone else who needs to take care of this, it doesn't work. We need to take care of things. We need to take the burden upon our shoulders and help the state of Israel go from a crisis to rebuilding the country. And everyone needs to take whatever he does or is going to do to the next stage. And we're trying to do that in Meuhedet, and we need to do that on the national level as well. Mm-hmm. And I really hope that it will not just be a crisis, it will really be an opportunity for a new Israel.
Yeah. And you said October 7th wasn't just a terror attack, it was a failure of the system. What did you mean by that?
As you can see, all the lights were there, but we weren't alert. And this is a problem that Israel, they say about Israelis that they know to adapt quickly and they tend to bring solutions out of the box and things like that. And it seemed like Israel worked according to some scenario, and the scenario wasn't the one which really happened on October 7th. So we can see with the army, we can see with everything that we didn't play along.
Yeah.
We need to go back to the fundamentals of the Israelis. We need to work out of the box. Yeah. We need to be really adaptive and understand that our surroundings change very fast, and accordingly to adjust ourselves and be prepared for the unknown.
Worst case scenario.
For the unknown. We do not know, but to be prepared for the unknown. COVID caught us, the HMOs, the health system.
Big time.
But we worked with what we had, and I think Israel performed excellent throughout COVID.
Yeah.
This is something we are very proud of, and we need to bring that to other parts of our lives as well.
Yeah, definitely. And despite everything, the also amazing thing was, civilians coming together and uniting and helping and volunteering in so many different ways. What gives you hope?
On the first days of after the war, the people of Meuhedet decided that it's not enough what they are doing within the clinics and the health system, and they went for, the farmers lacked workers.
Yeah.
So the people went especially to the south, and I've been there. We've done some work on the ground, and in the middle there was a siren, and there's no shelter around, and just people lie on the ground, put their hands over their heads, 10 minutes, and went back to work. This is an amazing resilience of the Israeli people.
Exactly.
And this is exactly what we are. And it brought tears to my eyes, even now that I'm speaking about it. And this is exactly what we are made of. And you can see it with people still functioning after a year and a half of war.
Yeah.
And within that context, when we are able during the war to expand, we opened a new clinic in Sderot, for example.
Yeah.
Sderot was always on my radar, and we had the opportunity, and of course the war was an incentive to do that. And it's a magnificent clinic, things that you do not see in the center of Israel, and very spacious and with excellent services. And to see the warmth of the community, happy to have competition, happy to have an alternative. Not necessarily everyone will transfer to us, but certainly will raise the bar for services in Sderot. And even if I'll be only small part of Sderot, but all the population in Sderot will enjoy the competition and the higher level of services. I've done my part for Sderot as well.
Exactly. Not only the center, you're focusing also on.
Yeah, it's very important to us, and the South is being now in the center of our focus. We got the government trust to build a new hospital, public hospital.
I heard.
In Beersheba. This is an amazing project. I think this is one of the most promising projects for Israel. Soroka there is an excellent hospital.
Mm-hmm.
It was very important during the very first phases of the war, but it's not enough for 1 million people, more than 1 million people, to be served by only one hospital. When in the center of Israel you have more than 10 hospitals, competition is very important. The ability to make a choice for the people is very important. And the government of Israel decided to build another public hospital and gave us this project, Meuhedet, together with Leumit, two HMOs, and Sheba, which is one of the leading international hospitals
in Israel.
And it's a long time project. It will not be tomorrow, and it's multi-billion dollars project.
Wow.
And it will change the South, not only in terms of services. Of course, it will be outstanding services, the best that there is, because it's a new hospital and the partners are excellent.
Amazing.
But it also, we look at this as a hub for development of the South, biotech, high-tech, together with Ben-Gurion University.
Wow.
We will bring professionals to work at the hospital. We'll bring professionals to do research and use the hospital resources for their research. It will change the South. It will be a major economic growth factor for not just for Beersheba, but also for the Bedouin community over there and everyone around the hospital. I think after we will build the hospital and we'll be operating, it will not be the same region, the same Negev as it is now.
Yeah, because they would probably bring a lot more population, doctors, high-level people, high-tech people to help build this.
Exactly.
So is this your vision? Is this what you see of the South? Are you...
Yeah. Wow. I think we have a great opportunity here, because after the war, everyone wants not just to rebuild the South, but to improve it. And this is exactly where the hospital fits. It's exactly the same need to be answered. And when I see the vision for the Negev in 10 years, it will be totally different. And assuming that we'll do what is needed and make Hamas no threat again for the Negev, it can be a great success for Israel.
Yeah. And on a personal note, one last question. Coming from the government and moving towards, the civilian clinics, HMO, why did you decide to do that?
When you're in the government and as a director general of the Prime Minister's office, you can do everything. Yeah. You manage everything. Everything comes to you, not the Prime Minister. The Prime Minister has very limited time. So people come to you to make decisions. But that's exactly what you are doing. You are making decisions about everything and sending it to other people to perform. You do not touch the real people of Israel. You touch decision-making process. And Meuhedet is really a place when you can touch and change individuals' life.
Yeah. And
you can touch communities, and you can see the things happening. And you can take a project like the hospital or like Sderot's clinic from the scratch to operation. This is amazing. This is amazing feeling. And I'm very happy. I'm very happy with both, and I will always travel from one to the other. But this is bringing something very rounded to my life.
Yeah. Well, let's hope that until the hospital is built, we'll still have you at this position.
Thank you very much.
And,
Or another, that's fine.
Or another. But you're always doing good, and that's...
I really appreciate your warm words.
That is very, very warming. Thank you for coming and joining us today, and I will meet you in New York.
Really looking forward.
Definitely.
Thank you.
Thanks.